Hi, Julie. Jeanette here. This is my presentation of the patient case study paper that I did with Shade. So when we first reviewed the case study patient, the first thing that came to mind was like, whoa, he has a lot of medical conditions. And as a result, he was also taking a lot of medications. And some of those medications seem to contraindicate each other, which alerted us that there would possibly be many treatment modifications and that we would have to prepare for emergency situations. Some of the treatment modifications that we needed to implement for this patient would include being aware that they may experience hypo, I can hypo orthostatic hypotension, and that we would just make him aware that this might be something he will experience from laying in the dental chair and then getting up. So we would just make sure that we do that in a slow process, and we ask him to alert us if he's experiencing any of those feelings. Because of his possible angina attacks, we would make sure to have nitroglycerin available. And also because he's taking a long list of heart and blood medications, we'd also be prepared for a possible heart attack since he seems at higher risk. Our patient also has GERD and Parkinson's, so to make him more comfortable, we would probably place him in a semi-supine position or a little bit more upright, just to help with those symptoms. And then finally, we would monitor him for bleeding, bruising, and poor wound healing within his oral cavity. So the drug interactions that we found the most significant, the first one was that there was interaction between the 3 heart and cholesterol medications that he was taking. The medications are Topiral, Zestoril, aspirin, and the herbal supplement fish oil and ginger. All of these together, they're giving the patient an additive effect of extremely poor blood clotting, and they make him at a high risk of anticoagulation. The next drug of concern for us was that he seemed to be taking way too much of his Synthroid medication. And in turn, he was experiencing what seemed to be effects of hyperthyroidism, which shows as negative side effects like nervousness, high blood pressure, anxiety, and that could be contributing to those symptoms that we were seeing in him in his appointment. So if we were able to talk with a pharmacist, our first question would be regarding the dose of the Synthroid that our patient is taking. We just note to the pharmacist that he's exhibiting signs of hyperthyroidism, and then just ask, is that dosage correct, or should it be the MCG? Our second question would be about the proper dosing of his 2 medications for the treatment of hypertension, metoprolol and the lisinopril. When used in combination as 2 antihypertensive drugs, the lisinopril should be dosed at a lower amount, so we would just want to run that by the pharmacist. Thirdly, we would want to note that our patient has I can never say this word, the pediche in his oral cavity, and we would ask if this is a sign of dyscrasia, which is like abnormal blood levels that would make it hard for your blood to clot and things, due to the multiple medications that he's on, which, given their interaction, this could be a side effect of. Our final question to the pharmacist is whether there are any treatment modifications we would need to implement based on the patient's medications. And though we've researched all of those medications, it's good to get a professional judgment from a pharmacist because they have more knowledge on drug uses and interactions. And after a long discussion, we realized the importance of a knowledgeable dental hygienist um, is that we are not only needing to be educated in pharmacology to provide safe and efficient oral care in our patient, but also that having this extensive knowledge makes it so that we're able to work together professionally with other medical providers to ensure that our patients are in optimal health and in and out of our chair. Just having that team camaraderie between the doctors, the pharmacists, the dentists, and the dental hygienists, we're going to be able to really provide the best care for this patient. If we all work together and we have common language and we have a base knowledge of what the other provider does within their role. And we also need to remember that our patients' oral care affects their entire body. So being able to identify and communicate with other healthcare professionals about our patients and their needs is crucial. So, yeah.